Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner and also a nurse educator. In today's video, I'll be going over 5 fundamental NCLEX questions. Nursing.com is an excellent resource if you are in nursing school. They have courses, cheat sheets, practice questions, study plans, sim clocks, have videos, and their courses and videos can guide you through nursing school so that you can consolidate studying and focus on what you really need to know. If you want to learn more about nursing.com, check out my affiliate link below. A nurse is performing an initial assessment for a client. Which of the following would be considered subjective? So subjective is something that the patient says. Objective is cold, hard facts, something that can be measured or observed. Received during the assessment. The client rates pain at a level of 6 on the numeric rating scale. The client's blood pressure increases when the provider enters the room. The client weighs 186. The client has a pinpoint rash on the face and the trunk. The client says his pain is at 6. That's subjective. That's what the client is telling you. Good communication during handoff is most important for which? Reduce medical errors, explaining a diagnosis, leaving no questions, discuss discharge. I mean, even if you get a good handoff, you're always going to have questions. Medical errors can be prevented and reduced if good handoff communication occurs. A nurse is caring for a client who is quadriplegic. The client has a sudden spike in blood pressure. What is the first thing the nurse should do? In patients with quadriplegia often have something called autonomic dysreflexia, and this is usually, in my experience, was related to like a full bladder, but it's characterized by a sudden spike in blood pressure. The client can also be diaphoretic. They'll be sweating. I've seen this in person. So they'll get a spike in blood pressure, and the first thing the nurse needs to do is raise the head of the bed as high as possible because this causes blood to pool in the legs, reducing blood pressure. Next, the nurse will need to determine the cause of the condition, such as full bladder, fecal impaction, or pain. A nurse giving discharge instructions to a client upon discharge from the hospital. A nurse is giving discharge instructions to a client upon discharge from the hospital. What should be included in the discharge instructions? Select all that apply. Side effects, the client medications to be given, when to follow up. Normally the ED doctor that you see, that's not who you're following up with. So upon discharge from the hospital, the discharge instruction should include a list of medications to be given, side effects. They should know when to follow up with their provider or specialist, any signs or symptoms to report to the provider, and what diet to follow. The risk management nurse at a long-term care facility is reviewing the facility's data related to recent client falls. The nurse should consider which of the following as a risk factor for client falls. Select all that apply. Change in mental status, gait disorders, yes. Muscle deconditioning. Hypotension can contribute to falls, not necessarily hypertension. The nice thing about nursing.com is you can always review the video if you have questions. Thank you so much for watching. Make sure that you hit that like button and you smash that subscribe button. I currently have a goal of hitting 30,000 subscribers. I've been at this for 3 years and still haven't reached it. So it would mean a lot if you subscribed, and keep in mind that it doesn't cost you anything to subscribe and you can always unsubscribe later. Until next time.